On this bitter cold February day, in the orange glow of twilight, the night ministry bus pulls away from the Ravenswood offices. Inside are staff and volunteers who are on a vital mission of service to the lost and forgotten people of the street, the growing homeless population of Chicago. The custom 38-foot outreach bus is a rolling beacon in the night, signaling to the needy souls it serves that someone does care.
That is very important. There's a lot of people that don't have anything to eat.
Every time I see the bus, I come. I stop by. Yeah.
Does it help you?
Oh, yeah, a lot.
You depend on it?
Yeah.
What about all of these other people? They depend on it too?
All the people, they depend on it.
As soon as the bus can park, the line forms at the door. Volunteers have already prepared the hot coffee and cocoa, knowing that their cold, sometimes frostbitten clients have been waiting hours for the bus to arrive.
And we have a nice drink and just talk with one another and try to cheer one another up.
It's very important for the community, for, struggling people, especially for the medical stuff.
The night ministry bus costs $60,000 a year in operating costs for fuel, maintenance, and insurance, and it takes approximately $200 per night to operate the bus. Bringing free medical care, outreach, and hospitality to a vulnerable population.
Try that and see if you like that. You want some hot chocolate too? You're going to make like kind of a cafe mocha.
They hurriedly sip the hot brew, warming tired bodies that are chilled to the bone. Their faces confirm the daily struggle for survival, an ongoing effort that only stops when the bus arrives, and the caring volunteers and staff offer a smile as warm and as sweet as the cocoa they serve.
Individuals come to expect to have the bus be at a certain street corner at a certain time on a certain night, and it's a very important part of their lives because they come to trust the staff members who are on the bus, and they need medical care, and they need a sandwich or a meal or a hygiene kit.
Each winter, many homeless individuals die from exposure. Others suffer mangling injuries from the cold.
We provide our listening ear. We help develop relationships. We help develop trust. And through that trust, we're able to get people to take on the daunting task of trying to access our broken healthcare system. We provide free medical care, HIV testing, STD testing.
HIV testing program provides rapid HIV tests, so within 20 minutes we get a result for somebody.
Bob has been a regular client who visits the bus. He has been homeless for 7 years since his father died in 2005. He walks 4 miles each way to find the bus and the services it offers.
I just recently had 9 teeth removed a couple of weeks ago, and they had me hooked up with a couple things where I was able to get to the dentist.
Living on the streets is much more complicated than just not having a place to live. The homeless are 3 to 6 times more likely to become ill than housed individuals. Diseases common among the homeless and precariously housed include heart disease, cancer, liver disease, kidney disease, skin infections, HIV, AIDS, pneumonia, and tuberculosis. Most homeless people use hospital emergency rooms as their primary form of health care. It's expensive to hospitals and the government and produces little, if any, follow-up.
We provide free medications, which for most clients, they go to a regular physician and are given a prescription, and it's as if they've never been because they can't afford to fill it. So I feel that we're making headway with a population that is pretty much invisible to most people. How's your diabetes doing?
The HIV infection rate among the homeless is 3 times higher than in the general population, and the death rate for homeless persons living with HIV/AIDS is 7 to 9 times higher than housed individuals living with the same disease.
The fact that we can talk with somebody about HIV risks and actually do the test and have a result for them within minutes. It's an incredible thing that we're able to offer.
The Night Ministries Health Outreach Bus visits 2 of the 3 top neighborhoods in Chicago for new HIV diagnoses. And 100% of patients who tested positive for HIV at the bus connected to follow-up health care.
One of the workers, he totally convinced me, well, why don't you just take a test? And I was scared to, but I did, and thank God that it came out negative. And but even if it was positive, it still would have been great to know.
The medical care is a big piece of what we do, and as the economy took its nosedive, or whatever it is we want to call it, several years ago, our medical numbers increased.
Thank you. Okay, ready? Okay,
thank you.
All right.
It frightens me to think what would happen to so many people if the bus went away. Our desperate sisters and brothers would still probably wait in line and cling to a glimmer of hope that the bus would arrive and bring them the medical care that they so desperately need.
You want some hot chocolate?
Hot chocolate.
The Night Ministry they do all they can to give sweaters, coats to homeless people. They ain't got no coat or hat or glove or nothing. They're a good program.
Each week, the bus travels to 6 neighborhoods around Chicago, serving thousands of very needy clients. 93,780 Chicagoans experienced homelessness from September 2010 through June of 2011. The Night Ministries Health Outreach Bus has made a total of 78,929 contacts to an estimated 5,950 youth and adults during the fiscal year.
It's been a help for all of us and homeless people here in Humboldt Park, and it has helped us a lot with the food and the nurse. So it's a good ministry.
This important ministry needs your help, and so do the needy clients it serves, who hope the bus never goes away.
That would really hurt a lot of people out here, because there's a lot of people where they can't get enough to eat, so this is one of their last resorts.